everyone, I'm Eileen. Welcome back to our series, Spill the Health, Real Talk, Real Health. Today, we'll have our Dr. Ian in the house to join in our podcast today. Welcome, Doctor.
Thank you.
So, Doctor, what is fatty liver?
Okay. Fatty liver is basically, simply put, fat deposition in the liver, because there is not supposed to be fat being deposited in the liver. It's usually in the rest of the body, but it is not on purpose. I mean, it's because of certain habits or because of certain diseases, and that's when fat started to be deposited in the liver. So basically, as the name states, fatty liver is fat in the liver.
So, how is it developed?
Okay. So what is most commonly known is due to metabolic syndrome. I think this day and age, there's a lot of Malaysians, especially with multiple diseases, usually high blood pressure, diabetes or high blood sugar, cholesterol, and also because of obesity. So what happens is basically a mixture of a couple of things, combination of things. One is when the liver receives more, I can put it, fat than usual, and it cannot process or break it down. The second is because of some of these metabolic diseases, especially things like diabetes, where there is something called insulin resistance, and the body cannot utilize the fats properly, if I can put it very simply. So then it starts to, again, deposit fat in the liver.
Okay, so how can we get rid of the fat, or it is reversible?
Okay, yeah. Fatty liver is reversible. Fatty liver is reversible. It's, again, looking back at what caused it in the first place. So if somebody has, as we said, the metabolic syndrome, whether it's high blood pressure, diabetes, high cholesterol, it's controlling those diseases well. If the patient is obese, then losing weight is important. But I think one of the things that we really need to look at is what we eat as well. I think commonly we tend to eat more than we need. And when that happens, of course, first of all, it develops all these other diseases. But basically, we are making the liver work harder than normal to try to clear these things. So even excess carbohydrate, not just fats, will actually cause fatty liver. So to put it very simply, basically we need to control our diet, watch what we eat, right? And if we have any diseases, patient has any diseases, they have to basically control, as what I mentioned previously.
Okay.
Yeah. Yes.
So would that, like the family history, like the diabetes run through the family, will increase the risk of the fatty liver?
That's a good question. If you're saying whether fatty liver is hereditary or it's genetic, I don't think it's discovered yet, but probably there is some components for certain people to be more predisposed to fatty liver. Yeah, there may be some link to genes, but I'm not quite sure. Yeah.
Okay. So because we normally nowadays the youngsters also eating out, and then we order the food very often. So how does the fast food and then sometimes, because youngsters also think that we eat supplements to improve our health, how does that affect the liver?
Okay. A lot of this highly processed food is probably also another cause of fatty liver. I think one of especially if it's high contents of fructose, or if it's high calorie, high carbs, high in fat and oil, all this will contribute. And I think a lot of times eating out, unfortunately, most places, maybe the diet is not balanced, right? Maybe it's more heavy towards carbohydrates, maybe more fatty, maybe more oily. So these things will contribute. Eating supplements does help, but it cannot completely counterbalance a bad eating habit. So it has to be overall balanced on both sides. They have to eat healthily. At the same time, eating supplements will help. So not saying that we shouldn't eat out, that you should cook, but I guess one can actually choose what they eat when they go out, right? And that probably will be more helpful, because not everyone can afford to cook, right? Not everyone, especially if someone is single, they can't just be cooking for themselves. Yeah.
Okay.
Yeah.
Okay. So because fatty liver levels are fatty, right?
Yes.
We normally, if one people is getting fatter, so they can go for exercise to reduce the fat. So is it same applied to fatty liver?
It does help. So what I did not mention earlier, besides diet and controlling any of diseases, healthy lifestyle is important. So you don't want to further insult the liver. But alcohol doesn't cause fatty liver, but they should stop or reduce as much as possible. Stop smoking, exercise, not just because when someone exercises, they tend to use more energy. So even if you do eat more, you actually burn off those calories. So exercise will help somewhat. Okay. Yeah.
Okay, so how do I know that I have fatty liver? Can it be detected through blood tests?
Okay. A lot of times patients find out fatty liver when they do health screening. Their blood tests can be normal. I do get patients where they do health screening, they noted that the liver function test is deranged, and usually we discover that they actually have fatty liver when they do an ultrasound of the liver. So when some form of imaging is actually required before they can diagnose that they have fatty liver. Not so much through blood investigation, not at this point of time anyway.
We do have fibrous skin in our Beacon Hospital. Do you think that it can also help to detect for the fatty liver?
Yeah, fibroscan can be used for two purposes. One, it can tell us how the severity of the fatty liver, and also what we like to look at with fibroscan is the fibrosis, which is basically whether the liver has turned hard because of inflammation or disease, or even because of fatty liver. So actually it has dual purpose. One, it tells us what grade or how severe the fatty liver is. At the same time, it can tell us how hard the liver is.
Okay.
Yeah.
And then because we all know that fatty liver, but we don't know how fatty liver will affect our health.
Probably initially we can't tell. I mean, some patients may have some complaints where it's very vague, a bit more tired, but we don't know whether we can actually attribute it to the liver, to the fatty liver. But as you know, liver has multifunctions, right? It produces, it also clears toxins, detoxification, whatever not. So it probably will produce some sort of symptoms. Some patients might say they're lethargic, they're tired, or just some general discomfort. Whether we can attribute it really to that, it's a bit hard to tell. Of course, in the long run, if the patient continues to have fatty liver and it gets worse, it can cause fibrosis, which will further deteriorate the liver function, right? And of course, with liver fibrosis, they're at higher risk of getting liver cancer.
This is for my curious only. So I want to know whether the liver enzyme test, right? Does it will reveal how the liver function?
Yes and no. So if you actually look at the liver function test, there are a lot of parameters. Look at total protein, AG ratio, look at the liver enzymes, which sometimes is written as AST, ALT, alkaline phosphatase, gamma glutyltransferase, and bilirubin. So each of it tells you a different function. So these things like ALT or alanine transaminase, or AST, aspartate transaminase, these liver enzymes basically tells you that maybe there's some injury to the liver enzymes, there's some inflammation, so it's a bit raised. So sometimes a patient who has fatty liver may have these markers raised because, like I mentioned, fatty liver can cause inflammation or basically damage to the liver cells, right? Things like albumin, protein, bilirubin is more of a production of the liver. So when the liver produces enough, you will see at normal levels. But it can also show other things like bilirubin at the same time. If there is blockages in the outflow, it can be raised. So yes, it does tell us to a certain extent the function, but it's only one of the many tests that we do, not just solely looking at liver function tests. Yeah, there's other blood tests that we actually use alongside with liver function to see how well the liver is functioning.
And then for the liver cancer, right, just now doctor mentioned that fatty liver will cause liver cancer. So what is the sign that I should have to like pay attention to for early detection?
Okay, so liver cancer, we're talking about specifically hepatocellular carcinoma, which is cancer coming from the liver itself, not from anywhere else. It can be caused by not just fatty liver, it can also be caused by other things. Commonly in maybe in Asia will be hepatitis B and even hepatitis C. So like most diseases and cancers, there aren't any symptoms initially, especially when it starts off small. So sometimes maybe patients will say they have some vague symptoms, they don't feel comfortable, but they cannot quite tell what exactly is causing the tummy discomfort. The best way to detect it early is actually through checkup, right? So if somebody has metabolic syndrome, whether it's diabetes, hypertension, high cholesterol, right, obesity, there is no guidelines for this, but probably it's worthwhile to check, the liver every once in a while to ensure that there's no problems. Because we've not formed a guidelines like hepatitis B or C when to scan the liver, but probably worthwhile to scan every once in a while, just an ultrasound, just to check and make sure that there's no changes in the liver. Whereas for hepatitis B and C, there are actually quite standard guidelines as the patient is being followed up by the doctor. Usually they will order some sort of imaging, usually ultrasound of the liver, every once in a while just to check if there are any changes in the liver. So long answer, turn short is you may not be able to detect by symptoms. It's better to just go for a checkup to catch it early if we want to catch it early.
So lastly, doctor, do you have any cases deserve to share today?
I think it's important to have this awareness about health overall, whether it's the liver or anything. But I mean, since I'm someone who deals with liver cancer, most of our patients unfortunately come to us when it's quite late, right? Maybe because they weren't aware, they're not sure, like I said, that the cancer initially when it started, they did not detect it. And unfortunately, a lot of the cancers come at a very later stage. Something that if caught earlier can be treated and would have a good outcome in the long run, right? So a lot of the patients that I see unfortunately come when it's the later stages. And maybe the treatment that we can give can help, but not as a good percentage that we would hope to give for someone who comes earlier. So it's very, very unfortunate. It's very, very heartbreaking, especially that some of these patients maybe do have some symptoms, especially early on, but hold on and don't want to come see a doctor. Or I think a lot of times patients choose to treat themselves by medication and not seek a doctor. I think it's very important. Sorry?
PCM also.
Yes. I think a lot of times they, buy their own medication, treat themselves instead of coming seek a doctor early. I think it's very important for patients to come earlier. Let us check it out, make sure that there's nothing serious. And if there is something, we hope to catch it early rather than later so that the outcome is good when we treat it.
So can thin people get fatty liver as well?
Yes, I think unfortunately they can. Um, this is what I was talking about, the genetic component. Thin people can get fatty liver, especially if their diet is poor. They may think that they don't have other diseases, but there are a proportion of people who can get fatty liver, even though they're thin. So, um, thin person, maybe someone exercise a lot, still should get some form of health screening. It's important to catch because you don't know. And then I've seen a lot of patients who live healthily, do everything that's right, and still have illnesses. So the caveat is that everyone should do health screening because you really don't know until we can figure out exactly what causes fatty liver or even a lot of the diseases. It's best to get checkup from time to time.
Okay.
Yeah.
So, doctor recommend for normal people when they go for screening, right?
Yes.
Doctor just recommend for routine blood test or also need to go for imaging as well?
Oh, that's a difficult question. I think we cannot blanket rule cover and say everyone must have certain things. Of course, blood investigation is the most basic thing, but I think what other screening that's required should be tailored according to the patient, right? Say someone is overweight, then maybe you need to do a little bit more investigation. Or say if this patient has very strong family history of cancer, then there may be some of the screening that you want to do earlier rather than later. So generally we have guidelines for most patients when to do what kind of screening, but I do believe that we should tailor it according to each patient. Yeah, that's why it's important to see a doctor and decide. It's good that a lot of people go to some places, take their bloods, do health checkup, but sometimes there may be other things that needs to be screened. So I do believe it's important to see a doctor to decide what should be checked, what should be screened, and we can tailor according to each patient.
Okay.
Yeah.
Right. Thank you, doctor.
Okay, welcome.
That's all for today. Spill the health, real talk, real health. See you soon.